Hello, my name is Todd Koling. I'm a heart failure specialist at the University of Michigan, and my team and I have put together this video called Your Nutrition Matters. It's part of our video series on healthy living with heart failure. We put this video together because we believe that the nutrition for heart failure patients is a critical part of the management plan for patients to be successful. We've seen a number of times patients that come in to see us who are not following a heart failure diet, who are having troubles with fluid retention, swelling, congestion, breathlessness, and frequent hospitalizations that we feel are unnecessary. Sometimes the only change that we make to their regimen when we see them is we ask them to follow a sodium-restricted and fluid-restricted diet. And when we see them on follow-up, we can see that they've been successful in keeping the excess fluid off of them. They may have less swelling, they have less congestion, their symptoms are improved, and most importantly, this can lead to reduced rates of hospitalization. And this video is going to hopefully help to teach you how to follow a heart failure diet. So if you're followed by a doctor caring for your heart failure, you've already received a number of recommendations for your care. You've been given recommendations for taking medications that are helpful in heart failure. You've been asked to stop smoking cigarettes, perhaps, to follow a healthy cardiac lifestyle, exercising regularly. You've been told to talk to your healthcare team when your symptoms change. This video talks specifically about the need to pay attention to the salt and fluids in your diet. So we'll first get started and talk about how to limit the salt and sodium in your diet and why that's important. This is a true story. A patient of mine, a 21-year-old woman who was recently released from the hospital only 3 weeks before, was calling me to say, "I can't breathe. I'm so short of breath, and my diuretics are not working anymore for some reason. My weight has gone up by 8 pounds in just one day. I don't understand it. I went out with my girlfriends yesterday and I was good. I'd been trying to follow this diet that you gave me that was low in sodium, and I just had an appetizer. That was it." Well, I asked, what appetizer could you have had that might have gotten you in trouble? Well, she chose a fried onion. And the fried onion meal, a serving size, has more than 1,260 milligrams of sodium per serving and almost 800 calories and 70 grams of fat. This is a common problem for patients when they go to restaurants. The food that they order tends to be very high in sodium, particularly fried food. Well, why does salt matter in heart failure? When you increase the salt in your diet, it gets absorbed in through your intestine and into your bloodstream, and that can lead to increases in blood pressure and heart muscle stiffening. When those two things happen, it can lead to reductions in your cardiac output and worsening of your heart failure symptoms, your breathlessness, your swelling, your fatigue. And when you have reduced cardiac output, the heart is pumping blood to the kidneys then hold on to more sodium and water that then leads to this endless cycle of worsening where you increase the salt, increase the blood pressure, reduce the cardiac output, and so forth. Well, is there any evidence that following a low salt diet benefits patients with heart disease? Well, certainly there are, and there's a large study that was done that was called the Trial of Hypertension Prevention, where they randomized more than 3,000 patients to one of two groups. Group 1 was asked to reduce their salt intake by 25% from baseline, and Group 2 was told not to change their diet. After 36 months of follow-up, the blood pressure in Group 1 was reduced by 1 to 2 millimeters mercury compared to Group 2. A very small change. However, there was a dramatic improvement in how patients did over time. that group that got the low sodium diet had a 25% fewer cardiovascular events such as heart attacks, heart surgeries, and chest pain episodes or angina. We also looked at data in hospitals in Michigan looking at whether doctors had given the patients advice regarding following a sodium-restricted diet. And we split patients up into two groups, one that got that recommendation and the second that did not get the recommendation for following a salt-restricted diet. What we found was that the odds of being readmitted to the hospital within 30 days of discharge were more than double for patients in the group 2 that did not get a recommendation to follow a salt-restricted diet. Well, how much sodium is too much sodium? This is a figure from the Centers of Disease Control, or CDC, and it shows that the average American or average person in the United States takes in almost 3,500 milligrams of sodium per day. It turns out our bodies only need about 180 to 500 milligrams a day, and that the tolerable upper intake level is about 2,300 milligrams a day. Some groups now have recommended that people follow a 1,500 milligram daily diet. Well, most heart failure specialists are asking their patients to follow a 2,000 milligram sodium diet because we feel that this is an achievable goal and one that clearly has been demonstrated to reduce clinical events in heart failure populations. Now, sometimes what we say is not what patients hear. If the doctor says lower your intake to 2,000 milligrams of sodium per day, sometimes what patients hear is no salt. And they respond by saying, my food will taste awful. I might as well stop eating. Well, what we're saying here is that we want you to follow 2,000 milligrams, not zero sodium. And that is something that is certainly achievable and tolerable. You can reduce your salt intake and still enjoy good food and meals with your family and friends. And we'll give you some tips and advice on how to do it. We think that you can do this and follow this diet. Here's some low salt habits that you may want to follow in your home. First of all, you need to remove the salt shaker. It's very difficult to follow a 2,000 milligram sodium restriction, much less adding salt to the food that you already have, that already contains sodium. You may want to choose salt substitutes. Many of these do contain potassium, so you may want to ask your doctor if they approve. You can use herbs and spices to season your food, and think about what types of food that you have in your cupboard or refrigerator. Are you using canned vegetables? They tend to be very high in sodium. Vegetables that are fresh or frozen tend to be very low in sodium. Switching to fresh and frozen can really pay off. Cheeses tend to be very high in sodium. Feta cheese, for example, has 316 milligrams per ounce, where there are lower sodium cheeses, such as Lorraine Swiss cheese. 1 ounce has only 35 milligrams per serving. Well, why is there so much salt in the food that we eat? Well, certainly it prevents spoiling, and it's a preservative. It keeps food fresh longer. It's also treated and used as a flavoring, and people get used to that taste. It disguises the metallic and chemical aftertastes of packaging for preserved food, and it reduces the perception of dryness in our food. So it's commonly used in processed food. You need to know that some foods can have, even within the same type of food group, can have low or high sodium. White breads can vary, for example, between 80 and 230 milligrams per slice. Eating out is also troublesome for heart failure patients. Heart healthy on the menu does not mean heart failure healthy. Many heart healthy items are low in fat or low in cholesterol, but not low in sodium. You want to ask for a low sodium menu, and you may need to ask the chef to cook without salt or with low salt. Restaurant food is really a very common source of unwanted sodium in your diet. There's some traps for heart failure patients in restaurants for sure. Mexican food tends to be very high in sodium. Italian food with the spaghetti and sauces can be very high. Pepperoni pizza or pizza in general tends to be very high in sodium. And Chinese foods that oftentimes contains monosodium glutamate can be very high in sodium as well. Look out for these types of food. Many people think that subs from a sub shop are very healthy for heart patients, and certainly it's true that they tend to be low in calories compared to other fast food alternatives, but they can be very high in sodium. A 6-inch Italian BMT, for example, has 1,300 milligrams of sodium before you add the cheese and the honey mustard sauce that can get you up over 1,800 milligrams. A lower sodium choice might be a Veggie Delight that has less than half of that amount of sodium. Well, what about fluid restriction? Why is that so important? Certainly sodium is not the only concern for heart failure patients. Watching your fluid intake is another important way to reduce water retention and swelling. There's really no amount of diuretic that can overcome the thirst of a patient that is very thirsty and is able to drink gallons of fluid without restricting their intake. We're asking you to limit your fluid intake to 2 liters per day, which is the same sort of 8-ounce glass recommendation that doctors have been telling patients for many, many years. That 2 liters is roughly equal to 8.5 cups for a 24-hour period. You may also hear 64 ounces. Your doctor may have a different fluid restriction that's more appropriate for you. They may ask you to drink more, they may ask you to drink less. In general, we tell our patients 2 liters a day. You'll want to record your fluid intake like you do with sodium or salt, and you'll need to include the sources of fluid that are in solids, such as ice, popsicles, juicy fruits like apples and oranges, grapefruits, and soups in your counts. The goal is to achieve a balance between your fluid input and your fluid output. Your fluid output is your urine and your perspiration, and your fluid input is the fluid in your diet and the water that's created in your body to create energy. When you can make these two equal, then you'll achieve a balance of fluid in your body so that you don't have a tendency to pick up extra fluid and become congested or become dehydrated. Well, many patients wonder why they feel so thirsty, and the reason is that patients with heart failure oftentimes have an increased level of a hormone called vasopressin. And vasopressin is also known as the anti-diuretic hormone because it reduces urine output, the opposite of what a diuretic does. When you increase your vasopressin levels in your bloodstream, it leads to less urination, higher blood pressure, and stimulates the brain to make you think that you're thirsty. And it can be very difficult to overcome this desire. We're asking you to do that, and we know that it can be difficult. Here are the tips to do that. You might want to snack on frozen grapes or strawberries that can keep your mouth moist. You could also do the same with gargling alcohol-free mouthwash or sucking on hard sugarless candies or chewing sugarless gum. There's also a product out there called artificial saliva, and many patients have used this with success. You may forget about other sources of fluid in your diet like ice chips, fruits, ice cream, and popsicles. Think about those sources of fluid in your diet. Now, every heart failure patient to follow a low sodium diet needs to know how to read nutritional labels. The U.S. government requires that all packaged foods have nutritional facts labels. And from that nutritional facts label, you should be able to reason how much sodium is in the food that you're about to eat. This label shows, first of all, we want you to look at the serving size. This label shows that a serving size is 1/2 cup. Well, many people don't just restrict themselves to eating a 1/2 cup of soup, for example. The servings per container in this is 2.5 servings. The sodium level in a serving, though, is 890 milligrams. So if you wanted to eat the whole can of soup, you'd have to multiply 2.5 times 890, and you would come up with 2,225 milligrams. So it's critically important that heart failure patients know how to read nutritional facts labels accurately to follow their sodium restriction. Now, some people look at that percent of daily value percentage, and that's based on the percentage daily value recommended for patients without heart failure, and that amount would be 2,400 milligrams per day. So that 37% number really does not apply to heart failure patients. Well, what does the low sodium mean on the label? And it turns out those labels are regulated by the government. Reduced sodium on a label means that the product has 25% less sodium than the regular product. So for soup, 25% less sodium on reduced sodium means 660 milligrams per serving, still more than 1,600 milligrams per can. For a low sodium product, they have to have 140 milligrams or less per serving, and very low sodium products have 35 milligrams or less per serving, and sodium free means less than 5 milligrams per serving. So we'll summarize. We feel strongly that lowering the salt intake can improve your health if you have heart failure. You need to follow a low sodium diet by eating less than 2,000 milligrams of sodium a day, keeping track of the sodium intake at every meal, and try to stay under 600 milligrams per meal. You need to follow a fluid restriction. Your fluid intake may need to be less than 2,000 milliliters per day. You need to record your fluid intake, and sometimes you need to record your urine output if you really want to get a handle on why you're retaining fluid. You need to learn how to read nutritional labels. Always look at the serving size first. Check the sodium content per serving, and then determine how many servings you will consume to calculate how much sodium you're taking in. We feel strongly that there are real benefits of following a heart failure diet. Following a heart failure diet that restricts sodium and fluid intake can significantly reduce your chances of hospitalization and can make you feel better by reducing your fluid retention, improving your swelling, and reducing your lung congestion. Remember, you need to take advantage of the most important person on your healthcare team, and that is you. Without you following your heart failure plan, your medications, your self-care practices, your daily weights, and following this heart failure diet, you will go a long way, if you can follow them, to being successful managing your heart failure problem. You may have a personal care plan that's different than what we've specified in this video. Every patient with heart failure is unique and may have different goals of care. Your healthcare team may have more specific recommendations that are meant just for you. There are other resources that are available. For example, at Michigan, there's the Mardisian Wellness Resource Center, at the Cardiovascular Center, where you can find books and information on recipes to follow a low-sodium diet. Well, thank you for watching, and on behalf of our team, we wish you the best of success and health managing your condition.